Did you know that some medical tests your doctor recommends after age 70 could do more harm than good? Imagine going in for a routine checkup, expecting to stay healthy, only to face unexpected complications from a test you didn't even need. Today, we're diving into a critical topic: health warnings for seniors specifically, 5 medical tests to avoid after 70 that may harm you. As we age, staying proactive about health is essential. However, over-testing risks in elderly patients are real, and they can lead to stress, unnecessary treatments, or even serious complications. I'm here to guide you through this with empathy and evidence so you can make informed decisions for yourself or your loved ones. Let's empower you to protect your health by avoiding senior healthcare mistakes that could cost you dearly. Picture this: Margaret, a vibrant 72-year-old retiree, loved her weekly book club and morning walks. During a routine visit, her doctor suggested a test she'd never had before. Trusting her physician, she agreed, but the results led to a cascade of invasive follow-ups. Margaret ended up with complications that left her bedridden for weeks, all from a test that wasn't necessary. Her story isn't unique, and it's a wake-up call about unnecessary health tests for seniors. Why does this happen? After 70, our bodies change, and some tests that benefit younger people may pose risks for seniors. Overtesting can lead to false positives, anxiety, or treatments that outweigh any potential benefits. By understanding health advice for older people, you can advocate for smarter care. Let's explore the 5 tests you should question, backed by medical research and expert insights. First, let's talk about routine PSA screening for prostate cancer. The PSA, or prostate-specific antigen test, measures a protein in the blood to detect prostate cancer. For men over 70, this test often leads to more harm than good. Prostate cancer grows slowly, and many men live long, healthy lives without ever needing treatment. However, a high PSA result can trigger biopsies, surgeries, or radiation procedures with risks like infection, incontinence, or impotence. The U.S. Preventive Services Task Force recommends against routine PSA screening for men over 70. Studies show that the test doesn't significantly reduce mortality in this age group, but increases the risk of overdiagnosis. For example, a 2018 study in the Journal of the American Medical Association found that treating low-risk prostate cancers in seniors often leads to complications without extending life. If you're a man over 70 with no symptoms, discuss skipping this test with your doctor to avoid overtesting risks in elderly patients. Next, let's address routine mammograms for breast cancer screening. Mammograms are vital for younger women, but after 70, the benefits diminish. Breast cancer in seniors often grows slowly, and many women may pass away from other causes before the cancer becomes problematic. Yet, mammograms can lead to false positives, unnecessary biopsies, or treatments like surgery that carry risks for older adults. The American Cancer Society suggests that women over 75 can stop routine mammograms if they're in good health and have a life expectancy of less than 10 years. A 2020 study in the Annals of Internal Medicine found that mammograms in women over 70 often result in overdiagnosis, leading to treatments that don't improve survival but cause pain or complications. If you're a woman over 70, it's crucial to talk to your doctor about whether this test aligns with your health goals. This discussion can help you avoid senior healthcare mistakes and feel supported in your health decisions. Now, let's move to routine colonoscopy screenings. Colonoscopies are the standard for detecting colon cancer, but after 70, the risks may outweigh the benefits for many seniors. The procedure requires sedation and bowel preparation and carries risks like bleeding or perforation, especially in older adults with fragile health. If you've had regular screenings with normal results, continuing after 70 may not be necessary. The U.S. Preventive Services Task Force advises that routine colonoscopies can stop at age 75 for most seniors. A 2019 study in the New England Journal of Medicine showed that the benefits of colonoscopy decline after 70, particularly for those with no prior polyps or cancer history. Instead, less invasive options like stool-based tests may be safer. This knowledge can bring you relief. Ask your doctor if you can skip this test to protect your health and avoid unnecessary health tests. Another test to question is routine bone density scans, or DEXA scans, for osteoporosis. These scans measure bone strength to assess fracture risk. While osteoporosis is a concern for seniors, routine DEXA scans after 70 may lead to treatments with more risks than benefits. Medications like bisphosphonates, often prescribed after a scan, can cause side effects like jawbone issues or atypical fractures. The National Osteoporosis Foundation suggests that women over 70 with normal prior scans may not need repeat testing every 2 years. A 2021 study in the Journal of Bone and Mineral Research found that frequent DEXA scans in seniors often lead to overtreatment without reducing fracture rates. If you've had normal results or stable health, discuss with your doctor whether you can reduce testing frequency to avoid health warnings for seniors. Finally, let's discuss routine cardiac stress tests. These tests, often done on a treadmill or with medication, check heart function under stress. For seniors over 70 without heart symptoms, routine stress tests can lead to false positives, triggering invasive procedures like angiograms or stents. These interventions carry risks like bleeding, kidney damage, or even heart attack. The American College of Cardiology advises against routine stress testing in asymptomatic seniors. A 2022 study in Circulation found that stress tests in older adults without symptoms rarely improve outcomes but increase the likelihood of unnecessary procedures. If you're over 70 and have no chest pain or shortness of breath, ask your doctor if this test is truly needed to avoid medical tests after 70. Margaret's story reminds us how quickly a single test can spiral into harm. After her ordeal, she became an advocate for informed healthcare, urging her friends to question routine tests. Her experience underscores the importance of health advice for older people. Knowledge is power, and you deserve care that prioritizes your well-being. So why are these tests still recommended? Sometimes, it's a habit. Doctors may follow outdated guidelines or fear missing something. Other times, patients request tests, thinking more screening equals better health. But as we've seen, overtesting risks in elderly patients can lead to a cycle of harm. By asking questions like, is this test necessary? Or what are the risks? You can steer your care toward safety. Let's recap the 5 tests to avoid after 70 PSA screening. Mammograms, colonoscopies, bone density scans, and cardiac stress tests. Each carries risks that often outweigh benefits for seniors, especially those in good health or with limited life expectancy. Always discuss your unique situation with your doctor, as personal factors like family history or symptoms may change. The equation, empowering yourself with health warnings for seniors, means taking charge of your healthcare. Share Margaret's story with your loved ones to spark conversations about smarter testing. Caregivers, listen closely. These insights can protect the seniors you love from senior healthcare mistakes. Before we wrap up, let's talk about what you can do instead. Focus on lifestyle factors that truly boost health. Eat a balanced diet, stay active with gentle exercise, and prioritize mental well-being. Regular checkups are still important, but they should focus on meaningful assessments like blood pressure, vaccinations, or vision checks. These low-risk steps offer high rewards without the pitfalls of unnecessary health tests. As you navigate healthcare after 70, trust your instincts. If a test feels excessive, ask for clarity. You're not just a patient, you're a partner in your care. By staying informed, you can avoid medical tests to avoid after 70 and live with confidence and vitality. Thank you for watching this deep dive into health warnings for seniors. If this video helped you or someone you love, give it a thumbs up and share it with your friends or family. Don't forget to subscribe and hit the bell icon for more health advice for older people to keep you thriving. Drop a comment below. You or a loved one faced unnecessary testing. Let's start a conversation to empower each other. Stay healthy, stay informed, and I'll see you in the next video.